Hey everybody, it's the first full day, so technically day two, but this is going to be your first day of not eating. And you can do this. We can do this. Don't worry, I'm nervous too, and I have done this. So it's we're gonna do this. So I thought I would start today with sharing just a few more statistics, but the main thing we're going to talk about is hormones in our body, the importance of sleep and controlling stress and insulin, and understanding our neurotransmitters a little bit better to understand why we have addictions to food and sugar and things like that. So that's going to be the main topic for today. So some of these are pretty appalling, but 41% of women greater than 21 years old are obese. So almost half of all women are obese. And 45% of women have high blood pressure. So, this really affects just your everyday life. This isn't like, oh, I have a disease and now I have to live with it. This impacts your every single day of functioning. And just a couple more. 1 out of 5 women will develop Alzheimer's. So we are in a surge of autoimmune disease like lupus and rheumatoid arthritis, diabetes, and Alzheimer's. They're at all-time highs. And if you look at children, the rate of obesity and diabetes in children, and rates of infertility. So I'm not like a fear-mongering type person, but sometimes it takes information like that to get me motivated to make change. So I'm right there with you. I have learned a lot of this information, and I still find this difficult to incorporate. And this has been a process over the last 2 years that I've really been doing a deep dive into my own personal health, as well as understanding what we can do about it that Western medicine isn't addressing. So Alzheimer's is actually starting to be called diabetes type 3. It's excess sugar in the brain. And there's more to it than that. That's a simplification of it. But, so many of these diseases are preventable. And I guess being someone who still has hopefully a lot of life left to live, I want to be able to function well and my memory's already going, but I don't need it to be even worse by the time I'm in my 70s or 80s or even 60s. So these things are really eye-opening to me, and the link to our food and our hormones is at the core. And so although I find it difficult to make changes to my diet, I can't suddenly say, I no longer like cheesecake. I love cheesecake. Okay. And that's not going to change. But what can change is how often I eat it, if at all. And that's a silly example, but it is about making choices. It is about looking at what do I want for my life? What do I want 10 years, 20 years, 30 years from now to look like? What do I want to be able to do? I remember the phrase growing up, like, oh, don't eat Doritos, they're going to kill you, or, just eating junk food in general. And the response was like, well, you got to die sometime. Well, you may die early, but the real issue is you're not going to be able to function well those later years in life, whatever your time frame is. And so that's the scary part. And just a little, personal information about me. A lot of you know, I worked in the ICU for several years, and most recently during COVID, and that created a lot of PTSD. Now that is a whole nother set of issues as far as my nervous system. So my nervous system now functions differently because of that traumatic event. And I've had to learn what that means. So that means I can no longer tolerate caffeine because that sets my nervous system off. And, that might be you as well. Just not because of a trauma, but because of perimenopause or menopause, or um, you have high stress levels. And so caffeine adds to that. So that's just a small example of, you really have to look at, just because you could tolerate it before doesn't mean you can tolerate it now. Um, and it became a self-evaluation of, my health is significantly declining. Am I at 44 years old going to need to, at the time I was 40, am I going to need to like apply for disability and be a lump on a log? Because not only PTSD as far as my mind and my nervous system, that also, I gained 50 pounds in less than 6 months, which creates another aspect of disease and lack of function. I'm not officially diagnosed with rheumatoid arthritis, but I absolutely have joint inflammation, joint swelling, those fine motor skills when you need to pinch something that really hurts, and it's very difficult. I've lost a lot of grip strength. And so it was just overwhelming at the time of the inabilities that I had in a 6 month to 1 month, 1 year period of lack of function. And it was like, I need to either do something about this, or how do I accept that I can no longer function as I could 1 year ago? And so that's really why I dove into this. So I got certified, got certified under Dr. Mindy Pelz. It's Pelz. And I'll try to include her links, but I usually post her quite a bit on my Facebook page. And I really feel like she has been instrumental in understanding the link between food, lifestyle, and how that affects our body. What does it do inside our body to create or heal disease? And that's really what this comes down to. And so I encourage you to not only do the fast, but even if you can't do the fast, just keep listening and gaining this information, and see how you can apply it to your life to start making changes, or realize maybe what habits or things you've been eating or doing that are contributing to some current health concerns that you have. So the first topic I want to talk about is the hormone hierarchy. So we have a set of hormones in our body, and this is mostly the same for men and women. Women obviously have more sex hormones. So, but the way they control each other is the same for men and women. So I'm going to start at the bottom, because these are the hormones that are affected by all of the other things. So if the other hormones are not in balance, these are going to suffer the most. And so that includes the sex hormones and the thyroid. Now that includes estrogen, progesterone, testosterone, and the thyroid hormone. So those are at the bottom. And those are controlled by insulin. And that was surprising to me. Now, I have a nursing background, but these are things that were never taught. And I don't think it's still taught very well in Western medicine in general. Because if it was, medical schools would have changed their curriculum to better understand diet, lifestyle, and hormone balance into disease, because they're directly related. And there is a shift, there is a wave happening. Medical schools are starting to change their criteria in what is being taught. So they are starting to incorporate diet, nutrition. I don't know how quickly that will happen, but a law was just passed that needs to change. So anyway, getting off track. So that's the sex hormones and thyroid. So that's going to affect your fertility. That's going to affect your perimenopause journey. So perimenopause, oh my goodness. Perimenopause is a 10-year period. That is where your body slowly starts to no longer produce estrogen and progesterone, at least not by the ovaries. And that slowly dwindles. And that time frame of 10 years is really important, because those hormones go directly to the brain. And that helps, estrogen directly helps your brain function. And so if you don't have balanced estrogen and progesterone and you're slowly losing the amount that your body's producing, it affects your ability to think. So what are some of the main perimenopause complaints? It's brain fog and lack of mental clarity, um, feeling like you're losing it a little bit. And so that's why the balance of these are really important. Now, can we stop perimenopause? No. But how off balance are you is going to determine how severe those symptoms are during perimenopause. So, in the thyroid, we have a huge rate of hyper and hypothyroidism in the world. And a lot of these are directly linked to insulin. So this is why, the keto diet was really popular, and there's a lot to be said for it because when you keep carbohydrates low, you have control of your insulin, and that automatically balances out those sex hormones, your thyroid hormone. But the thing that's missing in the ketogenic diet is nutrients. And so there's more to it than that. So one thing that Dr. Mindy has promoted is a ketobiotic, and she named that, but ketobiotic diet. So basically, you're going to stick to low carb. You're going to be keto, but you're going to make sure that you are getting ample amounts of vegetables, specifically cruciferous vegetables, because they are the building blocks of every cell in your body. So if you just focus on eating meat and protein, you might have better insulin control, but you're not getting nutrients and you're not preventing disease. You are still at risk for all of those metabolic health issues because you're not giving each cell the gas it needs to function. So insulin resistance is a huge part of perimenopause, but also of just if you've gained a lot of weight, or weight in general. So insulin resistance. So the insulin, you eat something and your body, and you have all this glucose in your blood, right? And the insulin is emitted by your pancreas. It says, okay, we've got a flood of glucose. We need to dump a bunch of insulin. And insulin is like the key at each cell in your body. And it's like it's going to the door of each cell and saying, I've got this glucose that I need you to take. And so insulin is the carrier of getting glucose into each cell so that it can use it for energy. But insulin resistance is caused by a multitude of things. So that is to the next hormone, which is cortisol, stress. When you have high cortisol, that creates insulin resistance. And here is the thing that was the most eye-opening to me, is that you don't have to work in an ICU or an ER or some stressful environment to have high levels of cortisol. So here are some things that were quite upsetting, to be quite honest. But if you have just 2 alcoholic drinks per week, so that can be in the same day, that can be just 2 drinks, 1 drink on a Monday, 1 drink on a Sunday. And if you continue that pattern, you automatically have a higher basal cortisol rate that is being emitted in your body. So cortisol is essential to life. Like it's what wakes you up in the morning. So cortisol isn't bad, okay? But when we have surges of cortisol or when we have higher rates being emitted, that's what's going to block your body from processing the glucose, and then it's stored. So that creates the difficulty in losing weight. You're like, I'm exercising, I'm eating better, but your cortisol is too high, so your body can't use the fuel. So all the more reason why fasting is a great tool to use to help bring down cortisol, bring down insulin. Let's get it back to a normal level and kind of hit that reset button. So here are some other things that raise cortisol that was also irritating. Let's say you're scrolling on social media. So you're laying there, it's before bed, and you're just trying to wind down, and you're scrolling on Facebook or YouTube, whatever, take your pick. And subconsciously, these don't even have to be conscious thoughts, but we do a lot of comparison. So again, I'm speaking to probably a lot of women, but I think men too. So you see someone who looks really pretty and you're like, oh, I wish I could look like that. You've just spiked your cortisol. You have those internal stressors that you're putting on yourself. You see someone, let's say you are having issues with fertility and you see someone who got pregnant and you want to be really happy for them, but inside you're like, oh, I wish I could get pregnant. Or maybe you're a little jealous. Those emotions help raise cortisol. So you don't even have to be doing anything physical for the cortisol to be raised. So that's why this is also so challenging. All those little things that we don't even realize are triggering our nervous system to go haywire. So all the more reason, self-care again is another buzzword for the last couple of years. But that's why we need to consciously do things throughout the day, every day, to lower our cortisol. What are some of those things? It could be exercise. That's also a great form of detox. Anything that makes you sweat. But the other thing is, so again, you're laying in bed, your cortisol is going up because you're triggered by something, or you're driving in traffic and your cortisol's up. When the event is over, so let's take driving in traffic for an example. You get home and you're like, oh, okay, I'm better now. But your cortisol is still being emitted. That doesn't just shut off. It's still going. It takes a while for that level to come down. So you're still dealing with that. So what do you do when you get home? You eat a big meal, but your cortisol is still high. So when cortisol isn't used, it is stored. So another reason that it's difficult to lose weight. So you're not only not using glucose in your cells, and that's being stored. Now cortisol, your hormones, are being stored. Any of the hormones. If you have excess estrogen in your body, which we'll talk about probably tomorrow about what to eat for each hormone. If you have, a diet that doesn't support those hormones, estrogen, progesterone, they're also going to be stored. And so that's where that belly fat comes in, especially for women. So you have to use it in order to lose it. So those are things. Exercise obviously is great, anything that's sweating. But if you can't do that, let's say someone just really irritated you at work and you were just really irritated and pissed off, go into the bathroom and do some air squats or some jumping jacks. Use the cortisol. That is a great tool to help bring that down. And a lot of the typical things like the breathing exercises, mindfulness-based things like meditation, yoga. Yoga is great because not only are you stretching your body, it does also incorporate the breathing aspect of it. And although it may seem silly and it may not change your mindset at the time, I remember being in the ICU during COVID and we had some therapists and stuff come around and giving us some techniques, and a lot of them loved the technique of box breathing. And it's like, okay, that is not going to help me during a crisis situation with my patient. So just leave me alone and get out of my way. But the benefit of those things are not necessarily to change your mindset towards that thing. That thing could still make you mad. You may still have a lot to do, but it's incrementally decreasing the stress on your body. And so you have to find a balance between things that are stress creating and how to release that stress. And that's every day. That's every day, every hour. We need to find that balance. And so if you're waiting until the end of the day to try and get that release, to, switch over your nervous system from fight or flight to your rest and digest nervous system, you've had a lot of buildup all day long. And that's going to take a long time to get rid of. It's not going to happen in just one evening. And so it's finding ways and techniques throughout the day to lower your cortisol level. And another great tool, so this is the final hormone. So like we talked about, we've got the sex hormones and thyroid hormones at the bottom, and they are controlled by insulin. And your insulin is controlled by cortisol. And the top dog of all the hormones is oxytocin. And so oxytocin is the feel good hormone. That's when you're around community, when you're around friends, when you're having a good time, when you're petting your dog, when someone gives you a hug. Those all release oxytocin, and oxytocin also lowers cortisol. So, how can you incorporate that throughout your day? You know, there's a lot to be said for if you're feeling down or stressed out, give a friend or give your mom a call and help bring that down, help bring your cortisol down. Oxytocin goes up. Now, oxytocin has a half life of only 2 to 3 minutes, so it doesn't stay in the body long. So, again, it's just an additional tool to help keep your body in balance. So, those are the main focuses of the hormones. And as you can see, that falls into a lot of other categories. So, what is the other thing that's super important for us? Is sleep. All of our cells need to regenerate. Our brain needs to regenerate. We need to be getting good sleep. But sleep is so difficult if your cortisol is high because it prevents you from being able to fall asleep. And then you're on this cyclical journey of trying to find a medication to put you to sleep. But again, that medication isn't going to get to the root cause of why you can't sleep. And so, and there's certainly more details to sleep than that. These are just some generic things, but I think pretty useful tools. So, sleep 7 to 9 hours, and it doesn't mean 7 to 9 hours from when you hit your pillow. It's from when you fall asleep. So, if you're someone that takes an hour to fall asleep, then you need to be getting to bed, an hour before that calculated time in order to get that amount of time. So, just something else to think about. Detox. So this is with exercise and with diet. Think sweating. Saunas are really popular right now, but we live in a very toxic society. So one thing I'll go into more detail another day is the ingredients that we have in our food. And a lot of these are obesogens, plastics, toxins. Our body doesn't know what to do with it. You're not just eating something and then it's emitted from your body. It is stored. Those toxins are stored. That's what causes cancer. That's what causes all of those metabolic issues, inflammation, chronic inflammation in the body, which is the source of all autoimmune disease. And so it's really essential that we detox our bodies. Diet plays a role in that. So staying hydrated. I know a lot of people don't like to be tied to a bathroom. It does get better over time once your body gets used to drinking that amount, but 3 liters to 1 gallon a day. And that sounds like a ton, and oh my gosh, I can never get that. But winter, it's even more important to be getting that. Remember, water is an essential element that every cell in your body needs in order to function. So again, if you're not giving it the right fuel and you're not giving it water, we can't expect our body to be healthy and function normally. That's when we start to develop issues over time. So saunas, dry brushing. So the key to detoxing is making sure our lymphatic system is going. And the lymphatic system doesn't have like a pump like our circulatory system does, like our heart. So it only moves, the lymphatic fluid throughout our whole body only moves when we move. So if you have a sitting job, setting a timer every hour, I'm going to get up and do 10 air squats. I'm going to walk around the office. I'm going to walk outside the building, just one lap around once every hour, something like that. I know they sound simple and we think like, oh, I can do that, but then we don't do that. So the important thing is that you actually start incorporating these. And it's always hard to have change because we're not used to that habit, but it does get easier. This is another really stupid example, but I'm good at these, so I'll just keep them going. But so our dog makes a huge mess when he eats now. He has no teeth. So his tongue goes crazy and it like flicks food all over the place. And it makes me have to like wash the wall and his bowl every day. And that was a really difficult habit to get into. I would constantly forget. And then the next morning it would be like caked on and we'd have to try and scrape it off. And then it doesn't really come off. But now it is just habit. As soon as he's done eating, I pick up his bowl, I put it with the dishes, and it gets washed. But that little trick of like remembering to go pick up his bowl after he eats was really difficult. Like it took months. It took months. So try not to be discouraged if you're like, oh, I'm just not remembering to do it. We have so many tools now to help us remember. Setting timers on your phone, making lists, um, having coworkers join us in on things. So like we're going to do power on the hour. So if I don't remember, I want you to try to remember, we're going to get up and go for a 5-second walk. So there's lots of things we can do to incorporate those things every day and help us remember. So that's a lot, but this is life-changing information if we can do it. It's no longer just, I know I should eat healthy and I know I should exercise. It's like you're choosing disease if you don't. It's and that meant more to me and made it easier to make those changes. It's still not easy, but it's easier to make the change when I'm like, okay, I have not had any nutrition in 24 hours. I need to eat some broccoli. And I'm just going to go eat the broccoli. And I'm not going to overthink it and be like, oh, I don't want broccoli. I want pizza. Just do it. Just eat it. So whatever it is, try not to overthink it and just get this stuff done, right? So, okay, that's it for today. I hope this was some helpful information. We're going to expand on this knowledge tomorrow, talk about ingredient labels, what foods do cause problems in our body and how it does that. So I look forward to sharing that information with you tomorrow and hang in there. Remember, if you need the fasted snack, go for it. That would be olives, an egg, bone broth, some MCT oil or nut butter, pure nut butter, every 4 to 6 hours at the most. If you need it, let me know how you guys are doing. Let me know. Send me a message either in my email or through Facebook. And please share this information. This is free for anybody, so share this knowledge with someone you know and share my page to help get this information out there. Take care. I'll talk to you tomorrow.